McAllen is the fattest city in America.
Mm-hmm.
So what methods do you commonly use to help individuals who are overweight or want to lose weight?
Well, I think that with all patients, we have to look at a holistic view, because the thing is, you can always say, eat healthy and exercise, but the reality is there's more to a person than that. If we have things like, for example, obstructive sleep apnea, these patients, their metabolic cycle is going to be significantly off because of that. And so you have to address that. If they have diabetes, you have to address the diabetes. A lot of people, when we talk about obesity, there's a mental health component with stress eating, anxiety, depression, these different things. And so we have to make sure that we're, number one, assessing the patient, because each patient is going to be different, so that we can formulate an individualized plan for them. That way we're identifying what their primary health concerns are. And then that way we can kind of apply necessary methods with, eating healthy, with exercising, like formulating, an exercise plan for them and things like that.
Got you. Because sometimes there's patients who maybe they're overweight and they started to have type 2 diabetes that's related to their eating. But maybe you're looking for the cause. Maybe it's because of depression and mental illness.
Exactly.
Affecting it, because maybe if you address that issue first, then everything else,
Yes.
start to fall in place.
Yes, exactly.
Awesome. Let's talk about, how do you manage a patient with more chronic conditions, such, for example, if someone has high blood pressure, severe obesity, or mental health issues? How do you know, can you give an example of how would you address a patient like that?
Well, the first step is assessing the patient, getting to know that patient, like what exactly are their health concerns. When we have conditions like severe obesity, those patients are going to be more prone to chronic pain, lower back pain, knee pain. And so we have to make sure that, number one, actually, if we are recommending exercise, maybe we start with low impact exercises like swimming, biking, things like that first, to keep the impact off the joints, and then we progress them from there. Things like hypertension, we need to make sure that their hypertension is very well controlled. But patients with chronic conditions like diabetes, obesity, high blood pressure, it's more important for those patients to address losing weight, eating healthy, things like that, than just, somebody else.
Hey guys, I hope you're enjoying the free content. And all I ask is that you subscribe. Click the like, share, and subscribe. We would love to have you. If you like this video and want to see more clips like this, click here. If you want to see the entire interview or the entire video, click here.